will set out our next steps out of lockdown and back towards a way of life that is much closer to normality. I intend to set out in some detail how and in what order we hope to ease restrictions between now and the middle of May, and I will set out, albeit in more general terms, our expectations beyond that. I must stress, of course, because it is simply an inescapable fact, that being able to deliver on the plans I outlined today is dependent on continued progress in suppressing the virus and rolling out vaccines. However, I do hope that this statement will provide welcome reassurance that brighter days are indeed ahead of us. Before turning to the detail, I'll provide some context on the state of the epidemic, and I'll start with a summary of today's figures. 597 positive cases were reported yesterday, which is 3.8% of all tests carried out, and takes the overall number of cases now to 210,605. 440 people are currently in hospital. That's 7 fewer than yesterday, and 42 people are in intensive care. That is 2 more than yesterday. I also regret to report that in the past 24 hours, a further 7 deaths have been registered, and the total number of deaths under that measurement is now 7,517. And once again, my deepest condolences go to all those who have lost a loved one. Indeed, 1 week today, when we mark the first anniversary of lockdown, the whole nation will be invited to share in a minute's silence as we reflect on those we have lost and on the painful sacrifices that have been made by so many over the past year. Presiding Officer, we are currently, as of now, recording across Scotland an average of 570 new COVID cases each day. And there are 2 points about that which it is important to make. The first is positive. Case numbers have fallen sharply since the early part of this year, as a result, of course, of the tough restrictions we're all living under. In January, we were recording more than 1,000 cases a day on average, and even just 3 weeks ago, the average number of cases each day was 815. So we've seen a significant reduction since then, which indicates the progress that has been made in suppressing the virus. The second point is slightly less positive. The 570 cases per day on average over the past week is up slightly from an average of 490 the week before. Now, that's not a massive increase, but it's clearly not the direction of travel we want to see, so we'll be monitoring it carefully and also taking it as a reminder that we have no room for complacency. Care and caution in the face of this virus continues to be essential. What is unambiguously positive so far is the progress of the vaccination programme. We have now vaccinated virtually all over 65-year-olds and also 59% of 60 to 64-year-olds, 41% of 55 to 59-year-olds and 34% of 50 to 54-year-olds. In total, as of 8:30 this morning, 1,943,507 people have received the first dose of the vaccine. That is already more than 40% of the adult population and is an increase of 34,516 since yesterday. We expect around 400,000 vaccinations to be administered over this week, and we hope that level can be maintained through April, subject, as always, to vaccine supplies. However, it's not just the scale of the vaccination programme that is positive. What we are learning about its impact is also hugely encouraging. We can already see that it is having a significant impact on the number of deaths. According to National Records of Scotland, the number of COVID deaths has more than halved in the past 2 weeks. And there are now also positive indications from research, including a study last week from Public Health Scotland, that the vaccines also reduce transmission of the virus, and that is really significant. So this provides us now with greater confidence than we could have had previously about the impact of the vaccine on suppression of the virus. And that in turn gives us more confidence about mapping a path out of lockdown with a firmer indicative timeline for lifting restrictions. We have, of course, announced and implemented some significant changes already. Last week, the restrictions on outdoor gatherings and activities were eased slightly, and as of yesterday, all primary-age children are back in school full-time, and the phased return of secondary schools is also underway. After the Easter break, which for some will be the 12th of April, we hope that all children will be back in school full-time. Now, obviously, we will continue to monitor the impact of these changes. However, I am able to set out now some further changes that we hope to be able to make in early April. I can confirm, firstly, that we expect to lift the current stay-at-home rule on the 2nd of April. Initially, although we hope this will be for no more than 3 weeks, stay-at-home will be replaced by guidance to stay local. In other words, not to travel outside your own local authority area unless for an essential purpose. People will continue to be able to meet up outdoors, including in private gardens, in groups of no more than 4 from 2 households. Our other changes in early April will take effect from Monday the 5th. On that day, we expect contact sports for 12 to 17-year-olds to resume. We also expect that from 5th April, more students, particularly in further education, will be allowed to return to on-campus learning. Colleges will prioritise those students whose return is essential, including those who are most at risk of not completing their courses. And that includes those who are taking qualifications in construction, engineering, hairdressing, beauty and related courses. We also expect to begin the phased reopening of non-essential retail on the 5th of April. Click and collect retail services will be permitted to reopen from that date, along with homeware stores and car showrooms and forecourts. And garden centres will also be able to reopen on the 5th of April, which I know is important as we head towards the summer period. And last, but for some of us definitely not least, we expect hairdressers and barber salons to reopen for appointments on the 5th of April as well. Presiding Officer, these changes will, I hope, make a real difference to people in a number of different ways. However, given the state of the virus and the extent of vaccination, what I have just set out is the maximum we consider possible at that stage to do safely. However, during April, we expect our vaccination programme to reach an important milestone. By the middle of April, supplies permitting, which I have to say is still a necessary caveat, we will have offered first doses of the vaccine to all 9 priority groups identified by the Joint Committee on Vaccination and Immunisation. These 9 groups include everyone over the age of 50 and all adults with particular underlying health conditions and, of course, all unpaid carers as well. And crucially, these groups account for a significant majority of the country's adult population. And even more crucially, they cover groups of the population that, between them, account for approximately 99% of all COVID-related deaths. So reaching that milestone and also taking account of the fact that it takes a couple of weeks for protection from the vaccine to kick in, it will give us confidence to ease restrictions much more significantly from the 26th of April. So on that date, we expect all parts of Scotland currently in level 4 to move down to a modified level 3. The island communities currently in level 3 will have the option to move at that stage to level 2. However, given what I am about to set out on travel restrictions, we intend to discuss that with these communities over the next couple of weeks. So let me turn firstly to the position on travel. We expect that from 26 April, restrictions on journeys within mainland Scotland will be lifted entirely. However, if restrictions on socialising and hospitality are relaxed more quickly and significantly on the islands, there may be a need to retain some restrictions on travel to and from the mainland to protect island communities from the importation of new cases. However, rather than just impose that decision now on our island communities, we intend to discuss it directly with them to determine what arrangements they consider will work best for their circumstances. We hope that restrictions on journeys between Scotland and other parts of the UK and the wider common travel area can also be lifted, if not on April the 26th, then as soon as possible thereafter. However, we need to keep this under review as part of our efforts to reduce the risk of new cases being imported into Scotland, and we will update the position during April. Reducing the risk of importing new cases and new variants is also directly relevant to the issue of international travel. We intend to discuss with the aviation sector later this week how and when non-essential travel to some international destinations may be possible again. Like the UK Government, we are certain that this will not be achievable before the 17th of May. However, our view is that it may well not be possible for a further period after that, given the circumstances and the situation with the virus in many other parts of Europe and the world. And even when overseas travel does resume, it is likely that a requirement for pre-departure and post-arrival testing will remain in place for some time to come. But we will keep this issue under close review. I want to turn now to the other changes we hope to make from the 26th of April. On that date, we expect all remaining retail premises to reopen. All tourist accommodation will be able to reopen from that date too, subject, of course, to any wider restrictions that remain in place, for example, on hospitality. We expect that libraries, museums and galleries will also reopen from 26 April. Our expectation is that indoor gyms will reopen for individual exercise on that date. Work in people's homes will resume, as well as driving lessons. And we expect that the limit on attendance at weddings, funerals and associated receptions will be raised to 50 from 26 April. From that date, the restrictions on outdoor socialising we expect will be eased further too. From that date, 6 people from up to 3 households will be able to meet outdoors and with no mainland travel restrictions in place, as I said earlier. 12 to 17-year-olds will be able to meet outdoors with up to 6 people from 6 households. Now, unfortunately, given that the risk of transmission we know is greatest inside our own homes, where it's much more difficult to comply with mitigations like physical distancing, we cannot yet say if it will be possible to have people from other households visit us indoors from this date. But given how important this is to all of us, we do intend to keep this under ongoing review. The hospitality sector will also begin to reopen from 26 April. From that date, cafes, restaurants and bars will be able to serve people outdoors in groups of up to 6 from 3 households until 10 p.m. Alcohol will be permitted and there will be no requirement for food to be served. We also hope, though this in particular depends on continued suppression of the virus, that there will be limited indoor opening of hospitality from 26 April too. This will be limited initially to the service of food and non-alcoholic drinks until 8 p.m. and for groups of up to 4 people from no more than 2 households. As was the case last year, venues will need to retain customers' contact details for 3 weeks after their visit. Finally, we will advise that from 26 April, people on the shielding list can return to work, children and young people on the shielding list can return to school or nursery, and students on the shielding list can return to college or university. And the Chief Medical Officer will write this week to everyone on the shielding list to provide more detailed advice. Now, as is obvious, the changes that we hope to make on the 26th of April are significant. We will therefore need to monitor them carefully. For that reason, we do not expect any further changes to be made before the 17th of May, 3 weeks later. However, from that date, we hope that all level 3 areas, or as many as possible, will move to level 2. We would hope that from that date, indoor hospitality could return to greater normality, with alcohol able to be served indoors and within more normal opening hours, though possibly with some continued restrictions, a requirement for booking in 2-hour slots, for example. The precise detail of any continued restrictions will depend on an assessment of the situation closer to the time, but we will be aiming for as much normality as possible. On 17th May, we also hope that adult outdoor contact sports and indoor group exercise can resume. We would also hope that cinemas, amusement arcades and bingo halls will reopen from that date, and that outdoor and indoor events, albeit perhaps on a small scale to begin with, will also restart. We will confirm capacity limits with the events sector over the next few weeks. We also hope that colleges and universities will return to a more blended model of learning from mid-May, meaning that more students can be on campus. Further face-to-face support services will also resume, as will non-professional performance arts. Finally, on 17th May, we expect restrictions on outdoor social gatherings to ease further. And if this has not proved possible before this date, we also expect that people will then be able to meet up inside each other's homes again, initially in groups of probably up to 4 people from no more than 2 households. Now, let me come back to that point, because I know that the restriction on indoor meetings has been one of the hardest parts of lockdown for most of us to bear. Unfortunately, though, it is necessary, and I note that the easing of this restriction is not expected before mid-May in England either. However, all of us yearn to meet with friends and loved ones indoors again, and I know this is especially important for those people who live alone. So we will be keeping this under ongoing review, and we will seek to restore as much normality just as soon as it is safe to do so. Presiding Officer, I also want to give an update today on business support. In the past year, we have provided more than £3 billion of direct support to businesses in Scotland, and for the entirety of the next financial year, we will provide 100% rates relief for retail, hospitality, leisure and aviation businesses. When I spoke in advance of the UK budget, I said that the strategic business framework, which supports closed businesses, would continue until June, even if some businesses were able to open before then. However, a number of businesses have asked us to instead adopt a model of restart grants as we emerge from lockdown. We've decided to follow this advice. So I can confirm that on 22nd March, recipients of support under the Strategic Business Framework Fund will receive a final 4-week payment. There will be no new claims after that date. And then on the 19th of April, recipients will receive a combined final payment comprising a further 2 weeks closure support and a one-off restart grant. For eligible retail businesses, this will mean a payment on the 19th of April of up to £7,500, and for eligible hospitality and leisure businesses, a payment of up to £19,500. And this will provide support that is both more generous and also more flexible than previously envisaged. Presiding Officer, the steps I have outlined today give a significant degree of clarity for the period between now and the middle of May. The unpredictable nature of this virus means, and I hope people can understand this, that it is difficult to give quite as much clarity beyond that point. However, our hope and ambition is that from the early part of June, all of Scotland will move to level 1, which will allow for a further easing of restrictions. And then by the end of June, we hope that all of Scotland will move to at least level 0. Now, level 1 and even more so level 0 will be a massive improvement on where we are right now. But those levels still involve some restrictions, and so we hope that we will be able to get beyond even that. We will be assessing the situation as people would expect on an ongoing basis with a view to restoring as much normality as possible. It is our fervent hope and also our tentatively increasing expectation that vaccination, continued and effective use of test and protect, and probably a continued compliance with some precautions like good hand hygiene, for example, will allow us to keep COVID under much greater control. And that this will then allow us to enjoy many of the things that we took for granted before the pandemic. For example, normal family gatherings where we can hug our loved ones, sporting events, gigs and nightclubs. Now, for me to set out a precise date for all of that right now would involve plucking it out of thin air, and I'd probably be doing it to make my life easier, not yours. So I'm not going to do that. But I do believe that over the coming weeks, as more and more adults are vaccinated, it will be possible to set a firmer date by which many of these normal things will be possible. And I am optimistic that this date will be over the summer. And I know I will not be the only one now looking forward with a real sense of hope to hugging my family over the course of this summer. Presiding Officer, 3 months ago, when we had to reimpose lockdown in the depths of December, it was a dark moment in an unbelievably tough year. I know how difficult the last few months have been, and I will never underestimate and I will never stop being grateful for the sacrifices, the really hard, painful sacrifices that everyone has made. But now, thanks to those sacrifices and the success of the vaccination programme, we are in a much brighter position. As we move further into spring, children and young people will be back in school full-time, shops and services, we hope, will be reopened, we'll be able to travel more widely, we'll be able to see more of our friends and loved ones and start to meet again in bars, cafes and restaurants. As we move into the summer, an even greater degree of normality, hopefully something much closer to actual normality, with the ability to hug those we love, will become possible. All of that should fill us with optimism. This is certainly the most hopeful I have felt about the situation for a long time. However, as you would expect, I do need to add a note of caution. I know this is the bit none of us want to hear, but the route back to normality does depend on continued suppression. Right now, things are much better, but hundreds of us are still getting this virus every day. Last week alone, more than 200 people were admitted to hospital with the virus. We are getting it under control, but it is still dangerous and it is now even more infectious. So we must continue to suppress it to the lowest level possible as we try to get our lives back to normal. So for now, please continue to stay within the rules. Until April the 2nd, please stay at home, except for specific purposes. Please don't meet people from other households indoors, and please follow the facts advice when you are out and about. By doing all of this over the last long, difficult months, we have protected each other and saved lives. By doing it in the few weeks ahead, we can make steady and sure progress back to normality. And we will continue to protect each other as we journey towards those brighter days that I do firmly believe are now in sight.
Thank you very much. First Minister, we're going to turn now to questions. I encourage all those who haven't already done so to press their buttons, and I call Ruth Davidson.
Thank you, Presiding Officer. Today's update, as briefed, has started to give some clarity as to when various sectors can reopen. Frankly, it's clarity they were calling for and expecting 3 weeks ago when the First Minister said she would reveal her roadmap out of the restrictions. But that notwithstanding, it will give much encouragement to those who are desperate to get back to work, shops to welcome customers and hairdressers to welcome clients. But a statement can be as instructive by what is not mentioned as much as the information that is. And we know there's a huge job to get public services affected by COVID back online, whether that's NHS testing and treatment, the backlog of court cases or support services for those with special needs. Presiding Officer, for a week, beginning with International Women's Day and ending on Mothering Sunday, last week was a particularly tough week for women. The disappearance of Sarah Everard and the discovery of her body shocked us all. It led to an outpouring of stories from women across the country of times that they'd been attacked or intimidated, catcalled, flashed at, followed, stalked, abused or threatened. The First Minister recognises this and used her own social media channels to offer support. And of course she can't solve all these problems, but she could offer specific action in specific areas to make things just a little better. The First Minister will have been as struck as I was this week by the number of women explaining how their horizons have narrowed during COVID, that basic pursuits that most men don't think twice about, like going for a walk or run or other outdoor exercise in the evening or after dark, simply isn't an option for them if they want to feel safe and stay safe. So I'm asking her to look again at moving up the reopening date of well-lit and well-supervised safe exercise spaces like gyms, so that people across Scotland, but especially women, can get out of the house and do basic exercise without fear. Another improvement would be to reopen all scans and stages of pregnancy treatment to partners, so that women aren't going through so much of the patient pathway alone. And further, the First Minister has previously talked of diagnostic testing restarting, but we know from recent data that urgent referrals for treatment of possible cervical cancer is down around half on rates for 2019. London is trialling at-home smears, so can the First Minister commit to looking at a similar catch-up scheme here? And finally, we've seen a rise in violent crime across Scotland, just at the time that the backlog of court cases has soared. Can we increase the number of High Court sittings and take the court on circuit so that those waiting for justice, particularly those having been subject to violent or sexual crime, can get that justice earlier?
First Minister.
Firstly, had I announced everything I've announced today 3 weeks ago, I would have been doing so without the confidence that we would have reached a stage of having suppressed the virus and vaccinated enough people to make it safe. And what I've tried to do, and some people will agree, some people will disagree, from day one of this pandemic, literally every single day, is take balanced decisions that put the overall safety of the country first. And that is what I am going to continue to do each and every single day. That's more important than headline grabbing or doing things to make the lives of politicians easier, because my job is to protect, as well as I can, the safety of the population. at large. And I would repeat again that because of the cautious approach we took coming out of lockdown last year, we kept things open longer than was the case in other parts of the UK. And of course, we're coming out now of our second national lockdown. Other parts of the UK are coming out of their third national lockdown. So these are decisions that are important to get right. Opening up public services that have had to be paused is a priority. And actually, it's because we give that priority, schools being at the top of that list, that we have to be more cautious with opening some parts of our economy, because we can't do everything when headroom to suppress the virus is so limited. So we have unapologetically and unashamedly prioritised the return of schools, and getting the health service back operating normally is a real focus now. The Health Secretary and I had a roundtable discussion just yesterday with representatives from across the health service, hearing directly from them about the priorities and the needs that they have. We've just established a new Centre for Sustainable Development in the National Health Service that is looking at innovative ways, at-home smears, for example, although I think we've got to be careful about exactly how we describe certain things. But all of that is part of what we are now doing to take forward the sustainable recovery of the National Health Service, while also supporting the health service to treat COVID patients for as long as that is necessary. On justice, significant investment in justice, significant work with the Courts and Tribunal Service has meant that, again, creative and innovative ways were found to keep court hearings and trials going, although there has been an undeniable impact on that, and we will continue to bring those services back as safely as possible. With gyms, I hope to see gyms open on the 26th of April for individual exercise, group exercise outdoors, so that people are not faced with having to do that on their own, and that's particularly important for women, particularly in current circumstances. We allowed that from last week to recognise the importance of that for people's physical and mental health. So none of this is easy. It will do nobody any favours for me to stand here and rush to do everything at once, because it will set us back. What we are setting out is a sustainable and steady path out of lockdown, back to normality, and I believe it's one that the vast majority of people across the country will support.
Thank you. Anas Sarwar.
I thank the First Minister for advance sight of her statement, and can I also pass on my condolences to all those that have lost a loved one. Steps to reopen our society and economy are welcome, particularly as they too impact on health and well-being, and I know that this will give much needed hope to people across Scotland, and that's why we need to make sure that this is our last lockdown. In the past week, we have seen a rise in the number of cases, and there are local areas where rates are still much higher than average. Whilst we want to see progress, we need to make sure that as restrictions are lifted, infection rates do not rise with them. Finally, reaching 400,000 vaccinations a week will also be welcome. But last week, almost 420,000 gold standard PCR tests went unused. Will the First Minister commit to using these in our schools and workplaces as restrictions ease? Effective testing and tracing is what will stop us going back into another lockdown. We also welcome the commitment of additional funding for businesses, but the eligibility and the speed of dispersal is crucial. Does the First Minister recognise that it will take time for businesses to recover even after the restrictions are lifted and lockdown ends? And does she agree that transitional support must be made available over the longer term to avoid businesses having to close and people losing their jobs?
First Minister.
Well, firstly, all of us want this to be the last lockdown, but it is not as easy as a politician simply saying that as a soundbite to make it happen. Making sure this is the last lockdown involves taking careful, cautious and sensible decisions, sometimes having to take unpopular decisions in order that we can make sure that our exit from this lockdown, even if it is a bit slower than we are all desperate for it to be, is a steady one and firmly in one direction, and that we don't end up setting ourselves backwards. So that's what I am focused on, and the government is focused on every single day. In terms of testing, we are using lateral flow devices in schools and increasingly in workplaces as well, because they are quicker to get test results. There is, no purpose in using PCR for asymptomatic testing, but it takes longer to get the results. So we are using lateral flow testing, and if those tests are positive, they then get confirmed or otherwise by PCR testing. The reduction in the use of PCR testing is actually because prevalence of the virus is falling, because PCR testing has been prioritised for people with symptoms of COVID, because that's what is really important. But we will continue to use all of our testing capacity, which is much more varied now than it has been before, as effectively as possible. And we're using testing in many more settings than was the case previously. On business support, what I've set out today is equivalent for eligible retail businesses to about 3 months additional support in terms of the start-up grant. I think for eligible hospitality and leisure businesses to about 6 months support. So it will provide additional support even after businesses start to reopen, and is more expansive than what we had previously planned. There will continue to be a need for business support in the medium term. We have always recognised that, which is why we have already made the commitment to 100% rates relief for the worst hit sectors for the entirety of the next financial year. And through the various different mechanisms we have, we will continue to appropriately support business as they get back to trading and back, hopefully, to making profits. And that's, again, to end on this point, that's why it's so important we get these decisions right, so that when businesses start to reopen this time, they stay open and can get back to normal, just like we all want to do.
Thank you. Alison Johnson, to be followed by Willie Rennie.
Thank you. The fact that we're in a position to start planning reopening things and getting our lives back will be most welcome for everyone. And as always, the Scottish Greens support a cautious approach. But the First Minister flagged an increase in daily cases compared to last week, which is concerning. And there have been reports of an increase in cases linked to the unsafe gatherings of football fans in Glasgow. So I'd like to know if the First Minister thinks this is reflected in these figures. And also, while the rate of positive cases is broadly decreasing across age groups, there is a marked increase in children under 14. So I'd like to understand what measures the Scottish Government is taking to address this trend. And finally, will the Government be introducing lateral flow testing for college, further and higher education students as they begin a very slow return to campus, so that we avoid the surge in infection caused by last year's chaotic reopening of universities? Thank you.
First Minister.
There will be a gradual return of students to further and higher education. We will use lateral flow testing as appropriate and in a targeted way to support that. The increase in students on campus that I've set out today for the early stage, from the early part of April, will be not exclusively but largely focused on further education, because that's where there is a greater need, if students are to complete their courses, to get them with some face-to-face learning on campus. In terms of the case numbers, we have seen an increase in the last week. As the Chief Medical Officer said yesterday, there have been a small number of cases of people that were gathering as part of the football incident last weekend. We may see more of that, given the incubation of the virus. That will not have fully worked its way through yet. But I think we also need to be really open-eyed about this. And after a year, I think we've probably all learned this. This is a virus, so any time we open up and people start to come together, there is greater opportunity for transmission, and we have seen schools return. It's not so much a worry about transmission in schools as about the activity that goes around the return of schools. So while I'm probably one of the last people to be complacent about any increase in cases. If I cast my mind back 2 or 3 weeks, we perhaps worried that the increase in cases we would be seeing after the beginning of the return of schools would be bigger than we're looking at it right now. So we will monitor that very carefully. In terms of younger age groups, the mitigations in schools are really important to try to reduce transmission there as much as possible. This is always going to be a balancing act. Any relaxation of restriction is not neutral. It increases risk of transmission. So we have to get all of the pieces of this as much in balance as we can. We've got a significant additional piece now with vaccination, which will help to substitute for some of the lockdown restrictions. But the need to navigate this really carefully, based on all the experience we've had over the past year, remains absolutely essential.
Thank you. Willie Rennie, to be followed by Annabel Ewing.
I'm sure people will feel a little bit of hope today. Their sacrifices And the brilliance of the vaccine scientists means that our liberty may return soon. And the dark cloud hanging over people struggling with their mental health might start to clear as well. So we must have the services ready to help them. The First Minister has been insistent that decisions on easing will be based on data, not dates. Yet the statement today has quite a few dates, but very little data. When will we see the indicators that will allow people to understand when they will be moving from one level to the next in their area? Can the First Minister be clearer about the indicators and the data?
First Minister.
Well, people, I think, want some clarity about the indicative timeline, which we're trying to give them. All of this is predicated, though, on the data continuing to go in the right direction. If the data starts to go wildly in the wrong direction, then clearly all bets are off. And that's why it is so important for all of us to continue to convey those messages of discipline and continuing to stick with it for a little bit longer. In terms of the move down from level 4 for all of mainland Scotland and some parts of our island communities, we want to try to do that as one country because that will allow us to lift travel restrictions. And even although some parts of the country are at lower levels of prevalence right now, because we are not yet at a critical point in terms of vaccination, it would still be very risky to lift those restrictions more quickly in those parts of the country. When we have done that, if there are outbreaks or variable transmission across the country, we will have the option of using the levels, and we will publish shortly the latest indicators that we would intend to use. As I had to say repeatedly before, it is not an exact science. But at the moment, for the whole country, it's about getting the virus as low as possible and keeping it there, recognising that as we start to ease, as I said before, it's not neutral. So it's a combination of all of this that we need to keep in mind as we try to navigate our way through these next few weeks.
Thank you. Annabel Ewing, to be followed by Maurice Golden.
Thank you, Presiding Officer. The setting of indicative dates for the initial easing of lockdown is very welcome news indeed. However, I do note the cautionary note that the First Minister has struck. And I wonder if the First Minister could clarify then by what date any change in plan would be communicated in the event that the COVID-19 data dictated a change of approach. This would be very important information to allow my Cowdenbeath constituents and people across Scotland to start to make firm plans as they seek to return to a greater degree of normality in their lives.
First Minister.
We would aim, as we have generally done throughout this, to confirm, hopefully, or otherwise, if things were not going in the right direction, a week before each of these dates about whether the changes are going to happen or not. I very much hope that will be confirmation. But the point that I've raised and Annabel Ewing has really underlined for me here today is that nothing with an infectious virus is set in stone. If we take our foot off the brake too quickly, ease up too much over these next couple of weeks, and the slight increase we've seen in the last week accelerates, then obviously, and this will be true for any country, we will need to reconsider. So if we want to keep on this firm, steady path forward, we need to continue, all of us, to be sensible. One of the things that I think should give all of us some cause for, if not concern, then at least lead us to guard against complacency, is there are many parts of Europe right now where things look as if they are going in the wrong direction again. So, this virus will take the opportunities. We're in a better position with vaccination, and that is really good. And increasingly, we think the vaccination will do the job that restrictions are doing right now. But we're not quite there yet in entirety, so we continue to need to have that balance. But if we all keep doing some of the same things that we've been doing for a long time now, then I do really believe that as we go into the summer, there's every reason to feel very optimistic about the way in which we'll be able to be living our lives.
Maurice Golden, followed by Claire Adamson.
Thank you, Presiding Officer. When will the Scottish Government publish updated guidance on restrictions contained within the tier system, especially the restrictions that exist in level 0?
First Minister.
We'll publish some of that, backing up what I've just said today, later today. It's possibly already published in terms of the update to the document. In level 0, one of the things we need to have some further discussion about and take account of the data closer to the point we might get into level 0 are things like the numbers of people allowed in stadiums or at events. We don't want to prejudge that too much and set that too low, or on the other side, raise expectations too high at the moment. So we will take a bit more time to come to final views on that, and I think I indicated that in my statement. The further out we go with this, it just gets less possible to be absolutely crystal clear about things. And the more you do try to be crystal clear, the more chance there is you will end up having to change the position. So we're trying to give clarity as far out as possible, but be upfront with people that we will need to assess things further down the line, a bit closer to the time.
Thank you. Claire Adamson, to be followed by Jackie Bailey.
Thank you, Presiding Officer. First Minister, what reassurance can you give to parents and carers and staff following reports of an outbreak of coronavirus at St Ignatius Primary School campus and its associated nursery in my Motherwell and Wishaw constituency?
First Minister.
I mean, this is going to be one of the difficult things on an ongoing basis with this virus. Even as we get, as we hopefully will, prevalence and incidence down, we will see outbreaks of the virus. And unfortunately, sometimes those outbreaks will affect schools and nurseries. Even if they're not in the schools or nurseries, there will be people associated with them. And they need to be managed in line with all of the protocols and all of the guidance and all of the correct mitigations. And I know that's difficult for parents and young people, but it is going to continue to be, unfortunately, a feature of dealing with this virus. Obviously, the more we can suppress community transmission, though, the more we reduce the possibility of outbreaks. We've already published a suite of comprehensive guidance on mitigations to reduce risk in schools and of course in secondary schools for pupils and for all school staff. That's now supported by regular at-home testing, which should also further reduce the risk of outbreaks and hopefully as community transmission continues to fall, so too will the number of young people affected in school-related outbreaks.
Jackie Bailey, to be followed by Stuart McMillan.
Age Scotland, Engender Inclusion Scotland and about 20 other civil society organisations have written to the First Minister welcoming her commitment to a public inquiry into COVID-19. They're asking her to work with civil society to take a human rights approach and consider the impact on a wide range of groups, including care home residents, frontline staff, women, people from the BAME community and older people. Will the First Minister ensure that the remit captures all of this? And given the length of time that public inquiries take, will the First Minister commission that inquiry now and ensure it reports in interim phases?
Minister.
I've already given a commitment to a human rights-based approach to a public inquiry. I believe we may still be the only part of the only government in the UK that has given a clear commitment to a public inquiry. If I'm wrong about that, though, I stand to be corrected. We will work with civil society as we decide the remit and all of the other decisions that have to be taken. That decision is already taken in principle. It will be, I think, and hopefully the state of the virus will allow this as well, it will be one of the priorities for the incoming administration, given that Parliament's are about to break for an election, to get the public inquiry properly up and running. If that is me and this government, then we will take that forward as quickly as possible, and hopefully if it was to be somebody else in another government, they would have the same commitment to doing likewise.
Stuart McMillan, to be followed by Donald Cameron.
Thank you, Presiding Officer. And I thank the First Minister for her statement, and I know that many businesses across Scotland will appreciate the clarity that is given on the course of direction out of lockdown and hopefully back to a greater normality as soon as it's safe. Can I ask the First Minister, however, to provide further reassurances for those businesses who are having to remain closed for the time being, that financial support will be made available to help them through what I know certainly will be a difficult and turbulent period for many?
Minister.
Well, the approach to business support that I've set out today is intended to combine ongoing support for businesses that have to remain closed or businesses that still have significant restrictions on their ability to trade on the one hand, and on the other hand financial support for businesses with the costs of restarting and reopening, having to order stock, for example, or do the other things to get a business ready to begin trading again. So that combination is one that businesses have asked for, and I think it does provide the flexibility of support. I hope that the vast majority of businesses, by the time we get into summer, will be operating again, but we have always recognised the need to support those who, for whatever reason, are not going to be able to do that. But our focus, as well as doing that, is to get business and the economy operating as normally as possible, as quickly as possible.
Donald Cameron, to be followed by John Mason.
Thank you. The First Minister will note a recent report which stated that more than half of severe COVID cases were transmitted in hospital during the second wave of the pandemic, and Scots were nearly 13 times more likely to become seriously ill from COVID if they had been in an NHS Scotland facility in the fortnight before testing positive. As we remobilise the NHS, can the First Minister explain what action she will take to prevent this from happening again?
First Minister.
Well, there is a direct correlation between community transmission of this virus and nosocomial infection and transmission. As we have seen community transmission fall, so too have we seen infection in hospitals fall, and therefore the most important thing initially is to get community transmission down. There is a whole range of work, not just in relation to COVID, but generally is undertaken in hospitals to reduce the risk of infection in hospitals. The Edinburgh University study is an important paper. It highlights a number of issues that the nosocomial review group has previously considered. It shows a strong epidemiological association between hospital exposure and severe COVID, but it does not confirm causality between the two. That doesn't make it not important, but it's important that that difference is understood, and it also makes clear that the reasons for that association are likely to be complex. For example, I don't think the report says this is me saying this, people already in hospital are likely to have health conditions already, so may be more vulnerable if they get COVID to becoming more ill with COVID. But we'll be considering that carefully and then feeding any learning from that into the wider work to reduce, as far as it is possible to do, risks of hospital-acquired infection.
John Mason, to be followed by David Stewart.
Thank you very much. On Saturday, I have to say I was delighted to get the AstraZeneca vaccine myself. I guess I'm slightly older than the First Minister, so maybe I got it before her. But I just wonder if she could give any reassurance to those people who have some concerns about AstraZeneca vaccine as seen in other countries.
First Minister.
I don't want to be churlish, but I think Mr Mason is significantly older than the First Minister from my memory. But I am anxiously awaiting my own vaccination appointment, since I'm now in the age group that is beginning to be called for vaccination. I think most people across the country, I'm really anxious to be vaccinated. Enthusiastic is probably a better word, to be vaccinated. And as soon as I get the invitation, whether it's Pfizer or AstraZeneca, I will be there getting my vaccine. To reassure people, though, and the Chief Medical Officer said quite a lot yesterday about this, to try to reassure people, vaccine safety is paramount. The safety of vaccines is monitored on an ongoing basis. There are well-established schemes, the yellow card scheme, that record adverse events, so that there is very, very careful monitoring. There's currently no evidence that we are aware of that suggests there is a risk from the AstraZeneca vaccine. What we are firmly of the view, is that the benefits of the AstraZeneca vaccine far outweigh any risk that there may be. That's the view of the MHRA, which is the UK regulator. The WHO and the European Medicines Agency have already said the same. So my advice to people is to come forward for vaccination as soon as you are invited to do it. There is massive benefit to that, and be assured that the safety of vaccines on an ongoing basis is something that is taken very seriously.
David Stewart, followed by Ruth Maguire.
Thank you, Presiding Officer. I am considerably older than the First Minister, and I'm delighted to say that I've had my vaccination. But does the First Minister share the good news from the European Medicines Agency today, which said that the number of blood clots in vaccinated people seem not to be higher than that seen in the general population? Is this not a positive message to those who have had or are awaiting vaccination?
First Minister.
It is. I was paying very close attention to the views that the European Medicines Agency have just articulated earlier today, and they are, as Dave Stewart sets out, they're doing some further review over the course of this week. But I'm not a clinician and I'm not an expert, so this is a summary of the position as I understand it, based on the advice given to me by the Chief Medical Officer. There is no greater incidence of blood clots from people who are vaccinated than there would be in the general population. And as I understand it, there is no definite association or causation between the vaccine and those who have had blood clots. So the advice from the MHRA, which, as I said, is the UK regulator, is that the risks are far outweighed by the benefits, and there is no reason for people not to take the vaccine. That is the view of the European Medicines Agency and the WHO as well. Getting vaccinated seriously and significantly reduces your chances of becoming ill or dying from COVID. And that, I think, is the reason why everybody should come forward and get their vaccine just as soon as possible, as I'm delighted to hear Dave Stewart already has.
Thank you, Ruth Maguire, to be followed by Jamie Green.
Thank you, Presiding Officer. Today's announcement is positive. However, there are many families struggling as a result of the economic impact of the pandemic, particularly those on low incomes, those who are sick or folk who find themselves in other vulnerable circumstances. With them in mind, can the First Minister outline what measures the Scottish Government is taking to assist?
First Minister.
Well, it's I think a really important reminder that in many different ways the impact of this pandemic is going to continue long after the COVID restrictions have been lifted. That will be true for many businesses, it will be true for public services, and it will definitely be true for individuals, some of whom were already struggling financially before the pandemic, others who have been plunged into financial difficulty because of the pandemic. We've taken a range of different measures: direct payments to low-income families with children, extending free school meals over holiday periods, increasing the funding to the welfare fund and for discretionary housing payments, protections against eviction, and a number of other things aside. And of course, during the pandemic, although it was planned before the pandemic, the new Scottish Child Payment has also come on stream and is starting to put money into the pockets of families. I think there's more to do, and just as support for business will continue to be something we have to think about, so too will support for individuals who've been impacted the most.
Jamie Green, to be followed by Ross Greer.
Thank you. Can I ask if today's framework essentially confirms that we're moving out of lockdown nationally at the same pace, with no scope for local easing? And can the First Minister assure businesses that if virus suppression and lockdown milestones are not met, that the Strategic Business Framework Fund will continue?
First Minister.
Yes, and we will keep the infrastructure of the Strategic Business Framework Fund in place, so that if we have outbreaks in future, or if there are any, which I hope there won't be, but if there is a need for any regional lockdowns, then that can be used to provide support for businesses there, just as was the case at the start of lockdown, or rather when we came out of lockdown before and we had to have regional measures in place. I very much hope, and we intend, that all of the country currently in level 4 will come down to level 3 on the 26th of April. Trying to do things regionally before then, I think, is impractical because of the need to get a sufficient number of people vaccinated before it's safe to lift restrictions to that level. And also doing it that way allows us to ease up the travel restrictions as well, which I know for a lot of people, particularly for family connections, is really important. Although I've already said there are issues we need to talk to island communities about. The level system will be there, though, if we need it, particularly after that, if by the time we get to the 17th of May or thereafter, much of the country can come down a level, but there's one part of the country that's got stubbornly high prevalence. We will have the ability to use it in a varied way, and I think that's important because we don't want to hold one part of the country back because of the level of the virus in others. But I think at this initial move out of lockdown, the more we can do that on a uniform basis so that everybody benefits from that and everybody can have the maximum benefit of that, I think that is the best way in the immediate term to proceed.
Ross Greer, to be followed by Mike Rumbles.
Thank you. Colby's Ice Cream in Mulgai are one of a number of businesses who struggled to access a business restriction grant. It appears this is because the guidance explicitly excludes takeaways, but the relevant regulations have since been amended to restrict the operation of takeaways. So can I ask the First Minister, if a takeaway business incurs a cost adapting to meet the regulations, is it now eligible for a business restriction grant?
First Minister.
I think if Ross Greer doesn't mind, I would like to look into the detail of the particular business so that I'm giving an answer that is appropriate and accurate to their circumstances rather than give a generic answer. So if he wants to email my office now or later on, I'll get that looked into and come back with a specific answer to him.
And Mike Rumbles, be followed by Kenneth Gibson.
I'd like to let the First Minister know that as soon as these questions are over, I'm off to the International Conference Centre to get my vaccination. Looking forward to it, at last. When, however, to the serious bit now, when the pandemic is over, will the First Minister learn the lesson that the government shouldn't introduce unenforceable laws which are impossible for Police Scotland to enforce, putting the police in an impossible position as many normally law-abiding people under the stay-at-home law and the travel restrictions in particular, more in the breach than in the observation, and it simply undermines the rule of law. And God forbid, if this ever happens again, while it is quite right, and I recognise it is quite right, that the government, of course, advises and encourages people to stay at home, it shouldn't rely on unenforceable laws because it does undermine the rule of law for many normally law-abiding people.
First Minister.
Well, first of all, can I wish Mike Rumbles well with his vaccine? There will be no truth in the rumour that I immediately get on the phone to the vaccination centre to ask for a particularly sharp needle to be used this afternoon. None at all. Seriously, it's really good and heartening, I think, for everybody to hear so many stories of people now getting their vaccination appointments. Look, we haven't introduced laws that we know are unenforceable. We've introduced laws out of necessity that we know are difficult to enforce, and we've worked very closely with Police Scotland throughout that. They've been frank with us where they thought we should change the balance of what we were doing. They've been frank with us where they thought a particular regulation might be more difficult to enforce than others, but they have done a sterling job in trying to encourage and work with the population to comply and using enforcement only where necessary. I hope we never have to be in a position like this again. I hope as we start to lift all of these restrictions, we never have to think about reimposing them. But actually, when you look at this overall, there's lots and lots and lots for all of us to learn out of this. But one of the most positive things, I think, has been the way in which the vast majority of the general population has done everything that's been asked of them, has made really painful sacrifices and actually got us again to a position where we can start to look forward with some optimism. And I know for one, I will never ever be able to properly and adequately convey my gratitude for that.
Kenneth Gibson, to be followed by Daniel Johnson.
Thank you, Presiding Officer. The First Minister will be aware that the UK Government is again failing to practice caution when it comes to air travel, leaving us potentially more exposed to new strains of coronavirus. While safeguarding international entry routes is vital, is the Scottish Government approach working when travellers can and are simply arriving at English airports and travelling north? Given the UK's laissez-faire approach, our airports could lose a huge number of routes and ultimately jobs as travellers simply dodge Scotland's airports to no discernible health gain. So how will the Scottish Government address this difficulty?
First Minister.
Well, we continue to work with the UK Government and seek to persuade them to take a more effective approach. You know, there's no getting away from the fact that the position on quarantine, managed quarantine, would be more effective if it was one that was applied uniformly across England, Wales and Scotland, certainly, and Northern Ireland as well, but particularly on the island. So we continue to try to persuade the UK Government to do that. Thus far, they don't appear willing, and we will continue to enforce that to the best of our ability, because it does minimise the risks of new variants being imported. Of course, the main message right now is don't travel overseas unless it is essential. There should be very few people travelling overseas. You know, hopefully, As we go through the next few months, that will start to change as well, but it is likely to be one of the last things that changes because of that risk, as in some countries the position remains very volatile and therefore that risk of importing cases, and particularly new variants of the virus, remains a very real one. So we've got to continue to be cautious.
Daniel Johnson, to be followed by Christine Graham.
At the end of last week, it became clear there had been a major problem with the issuing of blue letters, and that people between the ages of 5 and the Lothians had not been receiving their appointments. This resulted in the Health Board making pleas on social media for people to call and find out if they had an appointment. I'm informed that this problem has persisted and that some vaccination centres have had literally no patients over the last 2 days, and staff have been asked to go out, and I'm quoting my source here, drum up support from police stations or anywhere else to fill slots. So can I ask, what has gone wrong? How did this happen? How many people have missed their appointments? And most importantly, how will those appointments be rescheduled so that no one misses out on their vaccination?
First Minister.
This is an issue I am aware of. We have been investigating it over the past few days, trying to work out where the issue lies, whether it's with National Services Scotland administering the centralised system or with Royal Mail. We believe the possibility that it is a Royal Mail issue because other letters have been arriving, but we are still trying to bottom that out and resolve that, and I'll get the Health Secretary to update the member as soon as possible. But let me give an assurance to everybody who is expecting or receiving appointments that they will get their vaccination, and if there is a need to rebook any appointments, that will be done through the system that is already in place.
Christine Graham, to be followed by Graham Simpson.
Thank you, Presiding Officer. Can I endorse Daniel Johnson's concerns? I've got many of the same about NHS Lothian in my constituency, but that's not my question. First Minister, as you would expect, I very much welcome the opening of garden centres from the 5th of April, an issue I have pursued. However, can the First Minister clarify if this would be affected by the stay local rule, that is within your local authority area? For example, both Dobies and Pentland plants are just outside to the south, outside the City of Edinburgh boundary. Would they be able to have people visiting there from Edinburgh?
So between the 5th of April, when garden centres will reopen, I would describe it as less as Christine Graham pursuing the issue and more Christine Graham pursuing me on the issue over the past few weeks. But from the 5th of April to the 26th of April, the stay local rule will apply, and that will apply to people visiting garden centres as well. Now, there is within the regulations the ability to, if it is essential, go 5 miles outside your local authority boundary, but the central rule for that 3-week period will remain within your own local authority area, because as we start to ease restrictions, we have to mitigate against taking cases of the virus across different parts of the country. So whether it's to a garden centre or to visit your family outdoors in a garden, stay within your own local authority area. One stay at home is lifted until the 26th of April, when we hope across mainland Scotland travel restrictions will be lifted completely.
Graham Simpson, to be followed by Tom Arthur.
Thank you, Presiding Officer. I welcome news that travel restrictions are going to be lifted, but the First Minister didn't say when we'll be able to travel across the UK. So I wonder if she can tell us when she's going to decide that, and also at the same time say when she'll be able to give us clarity on when families will be able to stay with each other.
First Minister.
When I didn't give specific dates for these things, it's because I don't feel yet able to do that. I hope that the travel restriction between Scotland, other parts of the UK and the common travel area, I hope will also be able to be lifted on the 26th of April, if not on that date, then as soon as possible thereafter. But I said we would update during April on that position, because we need to guard against importation of cases, and we need to be mindful of varying prevalence and, of course, varying levels of restrictions being in place or lifted in different parts of the UK. So that's something we have to consider carefully. Similarly, with the ability to visit family indoors, it's already possible to see, in small groups, 4 from 2 households, people outdoors, albeit initially within your own local authority area. From the end of April, that will involve travel across mainland Scotland. We hope that around that time, we will also be able to gradually reintroduce the ability to visit family in our own houses. But again, it is not possible to say that definitively right now. And That is difficult because it's probably, out of everything I've said today, the one thing I want to be able to say to people, because it's the one thing we all desperately want to do. But the risk of transmission inside domestic dwellings is where the risk is greatest, because it's harder to comply with mitigation. So that's why I've said we're not going to wait, every week or 2 weeks or 3 weeks to review that. We're going to review that on an ongoing basis so that we can return to that position just as quickly as we deem it safe to do so.
Thank you. Tom Arthur, to be followed by John Scott.
Thank you, Presiding Officer. Throughout the pandemic, we have seen quite significant levels of variation in prevalence of the virus between local authorities and within local authorities at the neighbourhood level, with some communities seeing stubbornly high levels of prevalence. Can I therefore ask the First Minister what action the Scottish Government is taking to support these communities where suppression of the virus has proven to be more challenging?
First Minister.
Well, we've worked very closely with Public Health Scotland, with our senior clinicians network and indeed Test and Protect right throughout the pandemic to try to support local communities with particular local challenges and higher than average or stubbornly high levels of prevalence, and we'll continue to do that and provide that support to local health boards and local councils where appropriate. We have a national incident management team that meets regularly with local directors of public health to share best practice and agree actions that will help control outbreaks and drive prevalence down in local areas. And of course, one of the additional tools we now have at our disposal and have been using is community asymptomatic testing, and that has been targeted at areas where prevalence has remained stubbornly high, and we will make that available to communities where we consider it might help get rates down.
And John Scott.
Thank you, Presiding Officer. The First Minister will be aware that 2 primary schools in my Ayr constituency have had to close, having earlier reopened. This is because staff have either caught COVID or having to self-isolate. Are these temporary closures to be expected in other schools across Ayrshire and across the country? And also, will the First Minister again consider if early vaccination could be considered for teachers and also police, who are both still very much in the front line?
First Minister.
We're vaccinating, as all of the UK governments are, in line with the JCVI advice on priorities. As I've set out many times before, teachers and police officers will be included in these priority groups, and by mid-April, supplies permitting, we will have vaccinated everybody over the age of 50. By the end of July, we'll have vaccinated the whole adult population. And teachers and police officers who have underlying health conditions or who are older will be vaccinated earlier in the priority list. If we were to depart from that, I think we would rightly be criticised for substituting other considerations over the advice from clinicians on what is the best clinical strategy to reduce the impact of this virus. On the point about schools, while we've still got this virus circulating, regrettably, there are going to be outbreaks, and I cannot stand here and say that these outbreaks will never affect schools. That is simply not possible or realistic to do. What I do think is it's better to have schools open with, unfortunately and regrettably, some schools perhaps being affected by outbreaks than having all schools closed, because if all schools are closed, you never have that problem, but that affects the maximum number of children. And what we also know is the more we bear down on community transmission, the less chance there will be of outbreaks in schools. The more mitigations in schools are followed, the less chance of outbreaks. The more adults that are around schools follow all the rules, the less chance of outbreaks. And the more use that is made now of the testing offer to staff and pupils in secondary schools, again, the more we can reduce these outbreaks. We cannot take the prospect of that away. All we can do, all of us, is act in a way that reduces the risk as much as possible while we get as many children every single day in schools full-time as possible.
Thank you very much. And that concludes our statement. Thank you for your understanding. I'll let it run on a little bit longer, as it was a substantial statement and there was a number of members we wish to accommodate. We're just going to move on to the next item of business. Can I encourage all members leaving just to follow the one-way systems, make sure you keep your social distance, wear your masks and observe the other rules in place around mitigation measures around the campus. Thank you. A short pause while we move on.